Why is impalement injury stabilization so critical? Imagine a scene where someone has fallen onto a sharp fence or rebar, and a long metal rod is sticking out of their body. What do you do first? It might seem tempting to pull it out, but that's actually the worst move you can make. Stabilizing impalement injuries is a vital step in rescue and firefighting operations. It's about keeping the patient safe and preventing further harm. When an object is impaled, it often acts as a plug that stops major bleeding by pressing against damaged blood vessels. Removing it too soon can cause massive bleeding, which can be life-threatening. The goal is to control bleeding without causing more internal damage. Firefighters use bulky dressings to pack around the object and gently press on the wound edges. This helps slow blood loss and keeps the object from moving. Stabilizing the object also prevents additional injury during patient handling. Moving someone with a loose or shifting object can tear tissues, rupture blood vessels, or worsen internal injuries. Firefighters often secure the object with bandages, straps, or even clothing strips to keep it from jostling during rescue. This immobilization makes it safer to lift and transport the patient. In rescue scenarios, it's important to plan how to extricate the patient without causing vibrations or sudden movements. Firefighters may use special techniques, like creating a harness or using a backbod, to keep everything steady. They also take care to protect the patient's neck and spine, especially if there's a risk of spinal injury. Another key reason to stabilize is to give medical teams a clear picture of what they're dealing with. When the patient arrives at the hospital, doctors need to know exactly where the object is and how it's positioned. This helps them plan surgery and avoid surprises. Firefighters are trained never to remove the impaled object at the scene unless it's blocking the airway or absolutely necessary for self-extrication. Removing it prematurely can cause uncontrolled bleeding and worsen the injury. Only trained medical professionals in a hospital setting should do that. In the end, stabilizing an impalement injury is about protecting the patient from further harm, controlling bleeding, and making sure they arrive at the hospital in the best possible condition. It's a careful, deliberate process that can save lives and reduce complications during rescue and firefighting operations.